I get the question all the time, do we even need to do fillings on baby teeth? And it's a good question. Sometimes no, because the kid's getting older, it's not gonna bother them, then I'm not worried about it. But this is a good example. This was, let's see, do you see the pink here? So like this pink here is a little cavity, okay? But this is what it looks like on the x-ray, and it's like, okay, you have a cavity here that's into the soft spot of the tooth. On this one, it's really easy. We can use that laser. We do no shots, no drills, no numbing. The kid just goes right back to school after the visit. It's very easy. But then for this family, like life happened. I have 3 kids. I get that. For whatever reason, they didn't get that done. And so then they came back at their checkup and the tooth is hurting. And they say, hey, let's do that filling now. But the problem is it's much bigger now. So this is the cavity here. It's almost touching this pink part, which is the nerve. So like this is the cavity, it's circled in the red. So some of this bacteria may end up reaching the nerve. And so if that happens, then we have to put like a crown on the tooth and then maybe clean the nerve out a little, called a pulpotomy. And then they have to get numb for this. So it's just a lot more for them to go through. And then you're like, well, it's a baby tooth. Let's just remove it. Well, this kid's 5. And so that tooth is supposed to fall out when they're 10. So if you take the tooth out early, the teeth all like to touch, so they're gonna squish together. And then the adult tooth that's up here underneath that tooth gets stuck or doesn't come in right. So long story short is if your dentist sees a small cavity that they think is going to grow and the tooth still has a number of years, it does make sense to do that filling because it's something easy and conservative that your child can do simply, as opposed to waiting until it gets bigger and it has more challenges.